A new GLP1 option with no injection required seems to already be gaining traction. Eli Lilly's weight loss pill Foundayo is prescribed almost 1,400 times in just its first week of sales. This is the second pill version of GLP1s to reach the market after Novo Nordisk's Wegovy pill was approved in December. The oral alternatives following mass success of GLP1 injections like Ozempic, Zepbound, Wegovy, Mounjaro. And while the new pill has so far seen success, the FDA is now asking for more safety data on Foundayo specifically whether it could be linked to liver and heart problems. In a letter, the FDA said the data it has so far is not enough to fully understand several potential risks tied to the drug. Well, that additional review coming as thousands of patients are now suing GLP-1 drug makers alleging severe side effects. An estimated 12% of adults have taken these medications in this country, at least 4,400 filing suits since 2023. More than 100 people reporting the drugs blinded them, including a Maryland truck driver who says that he suffered an eye stroke that left him without his vision. And another severe symptom, gastroparesis, paralysis of the stomach, experienced by 75% of the plaintiffs ages 18 to 87. They say leaving them with pain, dehydration, even malnutrition. Joining us now is attorney Grace P. Chandler, who is on the plaintiffs' executive committee for GLP-1 litigation. Grace, it's good to have you here. I'd appreciate it if you help us understand. These drugs do come with literature. They come with warnings. We see a statement from one of the drug makers, Eli Lilly, claiming that, quote, labels include robust FDA-approved warnings. What do you say to that, and is what's out there not enough?
Thanks, Natasha. So it is important that we understand that these conditions like the NAION, the blindness, it's not just a side effect. That is a permanent, life-altering, catastrophic injury. And it absolutely the label needs to be specific. And while, yes, they do go through channels like the FDA to get their labels approved, it is the duty of the manufacturer to bring conditions like these to the FDA. And to notify the FDA that these conditions need to be warned about. So the duty still remains on manufacturers like Novo Nordisk and Eli Lilly to warn of these conditions.
Well, drug makers say the safety of GLP-1s has been established in clinical trials and reviewed by the FDA more than 40 times. What exactly is not meeting the mark here?
Of course. So these drugs do go through clinical trials and a lot of testing before they make the market. And again, we're not suing to get these drugs off the market. We're suing for the safety of these products and to make sure that the labeling is accurate. So while, yes, these drugs do go through a lengthy process, the manufacturer, like we said, is still responsible for updating the label as they get information back in post-marketing and complaints from patients that have been taking the drugs. So they are responsible for updating that label and for making sure it's accurate.
Can you share an example of the damaging side effects that one of your clients has experienced that's staying with you?
Absolutely. So you mentioned actually our client, Mr. Engel. He was the Maryland truck driver. He had just started taking Ozempic, had been on it for 6 months, and woke up one morning unable to see in his eye, out of one eye, which is common that it happens bilaterally, one eye at a time. With NAION. And as he went to his doctor, and his doctor reviewed the materials from Ozempic, did not see a connection to that condition, and advised that he remain on the drug. About 4 months later, he wakes up and he's blind in the second eye. And at that point, there was a study that had come out suggesting the connection between Ozempic and NAION. But like I said, that's a permanent condition.
Yeah, I mean, it's terrible what happened to him, of course, and I know he's not alone. It sounds like what you are arguing is that the doctor is not liable here, the FDA is not liable here, it is purely the manufacturer. Is that right?
Absolutely. That's in the United States, it is absolutely still the manufacturer's responsibility to update these labels and to keep them accurate and to make sure that they're informing consumers about the real-world consequences of their drug.
What is the status of the litigation? I mean, do you see these drug companies simply settling because they have made hundreds of billions from these medications?
It's always possible. Settlement is always possible. We are still what I would consider in the earlier stages of this litigation, both the gastrointestinal injuries and the NAION. The NAION litigation was just consolidated in federal court this year. So we are still what we would consider in early days. Unfortunately, the life cycle of this kind of litigation is quite long. We're discovering more as we're getting documents from the company.
And Grace, we're out of time, but I have to ask, I mean, many patients have health issues and comorbidities that are the reason they're getting on this medication in the first place. How does one definitively say the GLP-1 caused this and not the sky-high cholesterol or the hypertension that they're going on this medication for?
Well, that's one of the things that we do as a law firm, obviously, is that we will go through and review the patient's medical records and look for any of those other conditions that could be a cause for some of these other conditions. But, like we said, ultimately, we're not trying to get these drugs off the market. They do good. It's just really important that every patient has the opportunity to do a risk-benefit analysis and determine if this drug is right for them.
Attorney Grace P. Chandler, appreciate the time. Thank you.
Absolutely.